It's my great pleasure to focus on a topic that is, I said in my introduction, perhaps I think the leading edge, or in some ways the most important part of all the psychedelics research and the psychedelic therapy, which is integration. Because if you don't integrate, haven't you just wasted money and time and energy and tears? And the same thing, of course, is true. It's so important. Integration is so important for society and, our individual growth. Buddhists say no one's enlightened until all sentient beings are enlightened. And so somehow our individual integrations are, we hope, manifested as a collective societal one. So Catherine MacLean and Ingmar Gorman are going to speak to that topic and some other topics as well, and about their good work in that area. So let me read their bios for you. Catherine MacLean, PhD, is the director of the Psychedelic Education and Continuing Care Program, and a trained research scientist with a long-standing interest in the brain and the science of well-being. At the University of California, Davis, Catherine was supported by an NSF Research Fellowship to study the effects of mindfulness on well-being and brain function. As a postdoctoral research fellow and faculty member at the Johns Hopkins University School of Medicine, she worked with Dr. Roland Griffiths and his team. Her research on psilocybin and personality change suggests that this class of medicines may play an important role in enhancing mental health, promoting emotional well-being, and creativity throughout the lifespan. Her current focus is the role of psychedelics and meditation in preparing individuals for end of life and healing trauma related to grief. And if you'll bear with me, I'm going to read you also Ingmar's bio. Ingmar Gorman, MA, is a doctoral student in clinical psychology at the New School for Social Research. After receiving his BA from the New College in Florida, Ingmar served as a research assistant at the Prague Psychiatric Center and later at the Memorial Sloan Kettering Cancer Center. He received clinical training at Mount Sinai, Beth Israel Hospital, Bellevue Hospital, and at the Columbia University Center for Psychoanalytic Training and Research. He's currently at Bellevue Hospital for his clinical internship. Ingmar conducts psychotherapy research in MDMA-assisted psychotherapy for PTSD at the Multidisciplinary Association for Psychedelic Studies, that's MAPS, of course. He's also the administrative director of the Psychedelic Education and Continuing Care Program at the Center for Optimal Living, a setting where clients may speak about their psychedelic experiences and gain psychotherapeutic support. It's one of the few places I know of that's oriented towards specifically people who've been having psychedelic experiences can come to a safe place, not to do the psychedelics, of course, but to talk about the experience and to then perhaps access assistance if they need it. Clinicians can also turn to this program to learn how to best work with patients who have a history of psychedelic use, to understand what are the potential benefits and risks associated with these substances and how to provide optimal care. Ingmar's primary interests include psychotherapy variables in drug-assisted psychotherapy, therapist training, psychoanalysis, and integrative harm reduction psychotherapy for substance misuse. So I will turn you over to Ingmar and Catherine. Thank you very much for joining us today.
I have to say we were promised comfortable chairs, but we're going to do our best. It's such an honor to be here with all of you, with Ingmar, talking about this really exciting work we've been doing for the last almost exactly 1 year. And in the audience are so many people that we've been working with, including Andrew Tatarski, who is the director of the Center for Optimal Living. And the story of how the psychedelic program came to be is actually intimately connected with Horizons. So 2 years ago, I was speaking about my research at Hopkins, and I had actually just left my faculty position. So I was in a bit of a free fall. And I reached out to Andrew, and in a conversation said, I really want to keep using the skills that I developed while working at Hopkins, but I don't have a license, I'm not a trained therapist. I don't really know how I can work with people, and I have no interest in underground therapy. And Andrew said, well, I have a strong interest in this field, and I have a whole center that really is calling for something like this. And I have a whole team of therapists who could really support you in working with people. And so, of course, if it were just left up to me and Andrew, because we kind of have the personality type of getting drawn into all sorts of different things, who knows what would have happened. But thanks to Ingmar being pulled into the conversation as well, and having his own personal interest in getting a very similar program started, and the persistence and the very kind of hard, dedicated, serious approach to what is needed to launch a program like this here in New York. It actually all ended up coming together, and we launched the Psychedelic Education and Continuing Care Program 1 year ago here in New York. And so it's a really nice story about what a kind of a birth that came out of Horizons, and now that we're looking ahead to the next 10 years, it's exciting to think about what more could come when something like this only took basically 2 years. We have lots of information for you on our website that you can look at afterward, but today we're going to try to take you kind of deeper into our motivations and our perspective on what we're offering. Something that I'd like to say right up front, people always ask us, what is psychedelic integration? Like, what are you doing? What's your protocol? What's your agenda? And this is all very new for us. So we have our own experience with integration. We've kind of picked up little pieces of wisdom here and there, but we're learning, and we're inviting in all sorts of people and people who've been trained in all sorts of different traditions in a very collaborative, group-centered, inclusive kind of approach, so that we can learn how to best provide this thing called psychedelic integration for the community. And it's about attracting people with their own experience and wisdom to teach us about what's needed, and for the community members to tell us what they need. Andrew calls this a philosophy of abundance. When I asked him earlier today exactly what term he used, he couldn't remember, but it really stuck in my mind. So this term of abundance, that the more people that are called in to contribute, the more space is actually created for everyone to feel like they're getting what they need out of it, and that we're not here at the top telling everyone what integration is like. So we offer education, we offer training workshops, individual therapy, and community-based drop-in groups on a monthly basis. And so Ingmar will talk a little bit more about the integrative harm reduction psychotherapy approach that's offered by the center, and then we'll kind of go into a little bit of Q&A.
Yeah, so I just want to speak to how the Center for Optimal Living was a really rich base for our program. And just briefly to say that, in terms of the technical aspects of it, it's a CBT combined with dynamic conceptualization and mindfulness techniques combined into psychotherapy. But what really is important is actually, it's about a non-judgmental approach to people's substance use. And generally when we think about substance use, we think about substance misuse or substance abuse. And this is a community of people who are very, very stigmatized. And I think amongst people who use psychedelics, there's a similar kind of stigmatization. And so having a place where a person's relationship to a drug or multiple drugs are explored rather than something to be done away with, it naturally lent itself to doing some sort of psychedelic integration work.
Great. Okay, so this next portion, I will be asking Ingmar questions, and none of them are trick questions. He knows all of the questions that are coming up. We do have some slides. This was from our launch event a year ago. That's Andrew up there at the podium. And before we continue, we just want to acknowledge the amazing team of people that is supporting us. And there are actually a few faces missing. Our amazing web and graphic designer, Kaini Sanders, is actually in Korea. So she responds to emails in the middle of the night, but not this morning when I asked her for her image. So she should be up here as well. But we have an amazing team of people, some faces that you recognize from today. We wanted to create a kind of dream team of people who know way more than we do about psychedelic research, clinical practice, psychotherapy, and integration. We couldn't get everyone, it's like, I think eventually this slide will have 20 more faces on it, and everyone will be involved, so we'll kind of be like the Switzerland of the psychedelic community. Neutral territory, everyone gets to visit and hang out with us, and then go back to their territories. What I want to also point out is there are some people here who are much more in the indigenous shamanic world, and we feel like that we could not have launched a program like this without having that as an integral part of our advisory board. And so we take that very seriously, from the mental health field to doctors and also indigenous healers. I think that's all I want to say about that. So Ingmar, why don't you tell us a little bit about your background and what inspired you to focus on psychedelic integration?
Sure. So if you follow my career pretty closely, you'll find out that what I've been motivated by is basically learning how to do psychedelic therapy, but not really having the opportunities to do so. So very briefly, I'm talking about now 10 years ago, 8 years ago, looking at a follow-up to LSD research in the former Czechoslovakia. It was a way for me to talk to mental health professionals about their experiences, not just to do the science, but for me to maybe pick up on something that they were doing, to learn about how I could do something similar one day. With MAPS, Rick Doblin had mentioned adherence, so research looking at how therapists are following the manual for the MDMA for PTSD therapy, and that's something that I supervised. So yet again, it's sort of a way for me to peer into the psychedelic or MDMA therapy without necessarily me being there. And now I'm on my way to being trained as an MDMA therapist for phase 3. So it's getting closer and closer and closer, but that's something that it's always been my primary motivation. And that's also here in this program too, with the psychedelic program. It's this idea that, well, we're not giving people psychedelics, but what we can do with people who are choosing to do so or are maybe considering it, we can make sure that they're investigating this or doing this in the safest way possible and in a way that can minimize harm and potentially maximize the benefits of it.
Great. I wonder if you could take us into what a typical psychedelic integration therapy session looks like when you're working with an individual.
The answer to that question really is that there isn't a typical psychedelic or integration session. So this kind of bumps up against a little bit of several different thoughts that I have. One important thing is to think about it not being sort of a one-size-fits-all approach. And I want to really encourage people to think about the different sorts of level of functioning that a person may have when they are maybe pursuing integration work. There's people who are coming who may be wanting to engage in personal growth, and there may be people who have some serious psychiatric illnesses or disorders that may need assistance. And so I think the therapy needs to kind of reflect that. So I think perhaps there's this thought that, well, integration is just really about allowing a person's inner healing intelligence or their intuition or their process to unfold. And I think that's an absolutely essential aspect of psychedelic therapy, of integration. However, I think you have to also be very careful about what kind of person you're working with. And so when we're talking about individual integration work, I think assessment, diagnosis, and having a formulation about what you're doing and who you're working with is really, really important. I know this may not be something that we're typically thinking about when we're thinking about other kinds of approaches to integration, but this is sort of the way that we at the program, in terms of approaching individual work, that's how we think. So a thorough history, thinking about trauma, of course, and not just trauma that is interpersonal or traumatic events, but also maybe potentially how trauma could be a component of a person's psychedelic experience. If it was very scary, or in some rare and very unfortunate cases where people were taken advantage of while under the influence of the psychedelics, which sometimes, unfortunately and very sadly, happens. In terms of what an integration session might look like, there are many different components to it, and one of the ones that I really like to think about is integration as an unfolding process. So it's not like this is something that happens once after a person uses a psychedelic, but it's something that continues to unfold. A person's sort of thoughts and feelings and their growth takes a lot of time. And in that way, it's really important, I think, to be able to think about a person's life and what they're presenting with, but at the same time kind of being non-directive, because you don't necessarily always know what is best. And that's something that Catherine had alluded to in the beginning of this talk. Sort of, we don't necessarily see ourselves as experts. We kind of see ourselves as somebody people who are kind of cushioning this person's process. And then, of course, maybe before we switch to another question, embodying a person's a teaching. So whether that be through practice of meditation or some physical exercise or music, some way to kind of hold on to the experience. I remember, I think it was Bill Richards who had, in one of his talks, had this really great comment. One of the participants in one of the psilocybin studies said, how do I make this last? And he says, do everything that you can. And that's something that I really hold on to and think about.
So I think when we were originally conceiving of what this program would be, we were thinking about where are we now, but also how do we create something that can easily evolve into the future, whether or not psilocybin or MDMA is rescheduled, whether things are decriminalized, whether you can have it as a prescription or not. So we have purposely put ourselves in a pretty challenging position because we're saying we're going to start providing these services even though these drugs are still tightly controlled and restricted. And so I wonder if you could talk a little bit about the challenges that you see as being a psychotherapist about working with psychedelics in an environment where psychedelics are so tightly restricted and illegal.
Well, the thing that comes to mind the most is really some of the sadness that I think I experience as a therapist working with people, because people are using these psychedelics or MDMA under less than optimal conditions for what they want to do. I mean, if the aim is to have some sort of therapeutic effect, we believe that the best way to do that is in the presence of therapists in a controlled setting. And that's simply that is not available outside of the research setting. And like I said, or what I want to really emphasize, our program isn't about giving people psychedelics or connecting them to underground psychotherapy. We don't do anything like that. And so what happens is that I or my fellow team members find ourselves with people who are trying to get better. And sometimes it's very difficult to kind of sit there and really feel the sort of their suffering and also the limitations of where things are at currently in our sort of political climate, but also with the hope that may change.
Yeah. We're going to do a little experiential exercise, so I wonder if you could, right before that, talk about some of the challenges or some of the overlooked challenges for people in psychedelic integration, things that aren't really talked about when we talk about kind of the rosier picture of what integration can look like.
Yeah, this is one of my favorite topics. I'll try to keep it brief.
Okay.
So one is, I think people often conceptualize psychedelic integration being about some sort of, if I can use the term, like a massive download or some sort of incredible, very intense, mystical-like experience that is difficult to sort of, to integrate, to make kind of sense of. And so far with the people we've seen, that seems to be less the case and more about really the day-to-day. Things about navigating relationships or, just sort of day-to-day things that aren't necessarily mystical in a way. And another piece of that is...
Well, you were talking earlier, something that stuck out when you were talking about working with individuals is just if someone's in therapy, the change happens so gradually, but so they can kind of integrate it into their relationships, and it's not such a shock to their family or their friends when they're a totally new person. But
so if we want to conceptualize psychedelic therapy or MDMA therapy as something that makes psychotherapy more rapid, then and if it truly does work and there are rapid changes, it doesn't allow for example, like the family system to necessarily accommodate that change, and the family system may be sort of working towards an equilibrium or status quo, and maybe actually potentially working against a person's improvement. So an example of this, to make it a little bit more real, would be a woman who has a husband who has PTSD, and she experiences improvement, but the husband, his role in the family has been the provider and the caretaker. And what happens now when the woman no longer needs that kind of support anymore? What happens to the husband whose role has now changed? And that can be positive, but it can also create some other things, some negative responses, and I think that's part of the integration work as well. And the other thing that I might mention is also if we dynamically kind of conceptualize partly symptoms as being a defense or something that's a coping mechanism. If somebody, say through MDMA therapy, begins to see through their, say, maladaptive coping mechanisms, but there may be a period soon after the MDMA therapy where the person begins to feel sort of some of the symptoms, maybe like like activation or hyperarousal associated with the PTSD, but can kind of see through the coping skills that they used. I think it's really important to provide people with new coping skills so that they can handle these different things that are coming up for them.
Great. Okay, so it's the end of the day, and we've been spending most of the day kind of from our neck up. And now we're going to get into our bodies, and we're going to do a little experiential exercise that's going to require everyone to actually participate. So I want you to put both of your feet on the ground and sit upright. This is a little taste of how we do the integration groups. The nice thing is you don't need to know how to do anything other than breathe and remember back into the past, which most of us do all the time without any control over. So I'd like you to close your eyes if that feels comfortable for you, and we'll take some deep breaths, breathing in through your nose and out through your mouth, just noticing where you feel the breath most strongly moving through your body. Not needing it to be anything in particular. It could be slow or fast. Just relaxing into your breathing. And the pace of this will be a little bit faster than in our usual groups, but I'd like you to recall a single psychedelic experience or otherwise very intense experience from your past. And as you breathe, I'd like you to call in the body sensations of that experience into the present moment. So once you've picked a single memory, I'd like you to invite in your eyes. What are you seeing in that experience? The visions in your mind, and also how the world appeared while you were in that psychedelic experience. Without filtering, without judging, just allowing those visions to come back. And inviting in the ears. Hearing. What are you hearing in the experience? Sounds in your mind, maybe conversations, music, sounds of nature. Very importantly, not thinking about hearing or thinking about seeing, but inviting those body sense organs to re-experience their part in the memory. And inviting in your skin, the sensations of touching. How did your body feel in connection with the people around you, the space you were in? Maybe you were laying on the ground or blankets. Did your body feel expanded or uncomfortable? Maybe you were cold or too warm. Then inviting in the nose, smelling. We often don't talk about our smell memories, but they're very primal, core memories, and a very easy way for the body to feel a part of this remembering experience. So the smells, maybe there was smoke or sage, the smell of other people around you, flowers. And the mouth, the sensations of tasting. Maybe you were more sensitive to the normal taste of your own saliva. Maybe things that you were eating tasted different, or you were more sensitive, so allowing those tasting sensations some space right now. As we're breathing and re-experiencing, you may notice many other parts of yourself making the journey back and forth between the past and the present. We are creating a bridge that the body can recognize through these sensations, allowing them all in knowing that you are safe right here. And finally, if there was a person that was intimately connected with the experience for you, either during the experience or afterward, someone living or perhaps someone who had died but you felt their presence, another ancestor or simply a being, a spirit, inviting them into the space right now, welcoming them in, thanking them. And they can also help you connect yourself and create that bridge. And as lovely as it would be to do this for the rest of our time up here, I will ask you to take some deep breaths and open your eyes when you're ready. And we will attempt to go back to our normal programming. Thank you, everyone, for doing that with us. Okay.
So now I'm going to ask Catherine a few questions. So we've been doing this, like you said, these groups for about a year now, and I'm wondering, from your experiences in these groups, what have you noticed? What has stood out?
Yeah, so part of that experience that we all just shared together is how we start every group, and we help people connect as much as possible with their direct experience. And our philosophy is that each person is the expert of their own experience. And what I've found in facilitating these groups is that the more that I help create a safe container and help people connect with their own experience and then really get out of the way and only step in if things kind of start to go off track, people feel held and they feel safe to speak about their direct experience. And this is not talking about their experience, it's telling the story, but also inviting us all into their shared story. We've created this shared environment together to all be in the person's story with them. And something that I never really expected, but I saw happen time and again, is that the more time people had to really tell their story the way they needed to tell it, they would finally get to the deep point of the matter. And that was usually a space of emotion or potentially trauma or a wound, or a space of very deep appreciation. And it's taken a while, I think, me as a facilitator and also the groups to feel comfortable. But after many months of doing this, people are really starting to open up into these very deep emotional, spiritual spaces in a way that they feel safe and seen by everyone else in the group. And it's really amazing to see. And it's kind of like I learn something new every single time I'm in the groups. And I feel lucky that I just get to be there facilitating, and the less I think I know about what's going on, the more people are able to really connect with that direct experience.
Do you maybe want to say a few words about maybe your kind of personal connection to the work, maybe what brought you to it, or something that has kind of inspired you?
Yeah, I mean, there's so much in my own personal life that led me through my own path of integration. But the starting point with psychedelic integration began with the work at Hopkins as part of the spiritual practice study. I was one of the head researchers and session guides, but I also had the honor of working with Mary Casamano, facilitating the high support spiritual groups where people would come every other week, and everyone who'd had a high dose experience would come together in a group, a small group, and talk about their experience. We had kind of exercises that they would do around spiritual practice and awareness. And I saw some really amazing stuff come out of that group process. So this is a ripple from that work. And it's a ripple that has widened and become, I think, less top-down. Since we're not doing a research study, we don't have any particular interpretation or set of integration practices that we need people to do or want to kind of move them in that direction. So instead, we just kind of get to open up the space and learn from people telling their own stories and asking questions like, how do I do this? You know, one person asked me, how is DMT not like being a corporate lawyer? I was like, that is a very good question, and you should keep asking yourself that question, because I don't know the answer. And so that's been a real, I think, inspiration for me, is that past, but also more recently, one of my teachers who's also on our advisory board, James Lohr, is talking about how integration involves the individual, the community, and also the cycles of nature. And so most of the psychedelic work focuses on the individual, a little bit on community. We're entering at the point of the community and then helping kind of weave back and forth, ideally between the individual and these cycles of nature. But of course, we're in the middle of Manhattan, and the cycles of nature are sometimes less apparent. So we're still kind of working on that piece. How do we connect people with something much, larger than themselves and their community? I think we're almost at the end. Okay. Yes. Okay, so you wanted me to tell us, everyone what's going to happen in 10 years. So I have a little plan here about what's going to happen 10 years from now. So we are already starting it. We're going to be moving into a new space. The Center for Optimal Living is going to be right next to Grand Central, basically, right in the heart of the city. And we're going to have our own, it's awesome. And Andrew's super excited. This was happening kind of in parallel with the program. And so part of that space, in addition to therapy offices and a really nice little waiting room, is a larger group space that we're going to leave open rather than dividing up into therapist offices, so that we can do more small group work, we can do body-based work, we can do meditation and yoga and sound journeys and trance rattling and holotropic breath work and everything but the drugs. And so it's going to be really awesome. It's going to be a sanctuary in the heart of the city, and it will be a perfect place to see all of this through at least the next 10 years. And we see that place as being a hub for many different allies and psychedelic ambassadors and people from all different walks of life to come and help us learn and to teach others. So we want this space to be a communal resource that benefits the program, benefits the center, helps our clients and our guests, but also is a place for all of you to come and share what you know. And since it's our space, we can do what we want with it, and it's really, really exciting. And so I think that the future is going to include a lot of little places like that all over the country. I hope with as little regulation as is needed to maintain safety and as much freedom and access as possible. And I imagine a really exciting future, and I hope a lot of it is focused right here in this amazing city that we're in. So,
Thank you.
Thank you so much, you guys. Thank you.
okay.
Thank you. And so when we all are legal and rescheduled, and it's 10 years hence, you guys are going to have a lot of experience in a whole infrastructure and training and understanding of this process in place to hit the ground running. I'm very excited about that. I hope you expand. I hope you become the McDonald's of some sort of franchise model where you expand like mushroom spores. All right, questions and some answers.
My name is Nick. Really appreciate your guys' talk. It kind of echoed a lot of the frustration that I've been feeling throughout this. I'm hearing a lot of optimism, but as a recent master's graduate, I kind of find myself feeling like, how do I get involved in what you guys are doing? Psychedelic therapy, integration therapy, things like that. How does somebody like me go about getting involved?
My first encouragement would be do you live in New York? Please come to one of these groups and bring people that you know. We are trying so hard to reach out to people. Bob Jesse was sharing with me earlier today that there's this idea of attraction, not promotion. We believe that what we're offering is needed in the community, but we don't want to be pushing anything on anyone. So it really depends on all of you actually coming to some of the events that we're offering, whether it's the monthly drop-in groups, which are only $20, $25. It's really low bar for entry. Bring people who you think might be interested. They don't have to have psychedelic experiences. We'll be offering more small groups. You can try out the individual therapy too, if that's kind of, so you're learning more about the therapist side of it by actually doing the therapy yourself. We have a training workshop coming up that's all day long on October 22nd in collaboration with Sarah Gale from the Zendo Project MAPS. But we need the community to show up so that we learn better what we can provide. And I think in terms of how you can get involved, I don't know if Ingmar can speak more to that side of it with.
Well, I guess just to echo what Catherine had said, so when I was in Prague at the Beyond conference and I led a little integration group there, the intention of it being able to spread. So we very much like other groups like ours, and they do exist in other states, but we think it's important for it to spread. At the same time, I think the tension between peer support and somebody who has spent a very long time studying these topics, I think there's a tension there. And being an MA student, I don't know what you're studying or what your field is in, but I think it's really important to be able to be a good diagnostician, to be also equipped with the tools to help somebody with whatever they're working with. And then a different role is maybe being in a group and providing peer support. So there are different avenues of doing it, but I kind of fall down on a little bit of the stricter side in terms of individual work and really having kind of a training to be able to do that. So pursuing that.
But yeah, even just coming to the groups, I think you'll get a much better sense of kind of our approach, and it's an amazing community of people that are already showing up, and we think that that's just kind of the tip of the iceberg, that there's a lot more people who are interested, have things that they want to share, are unsure about, and we're hoping that if every one of you, if you can, comes to one of these groups and brings, tells to other people or brings someone with you, then it'll kind of start to spread more organically, and we can, I think, learn more how to best address these needs.
Excellent.
Hi, actually first I'd just like to say that I was for several years a therapy patient at Optimal Living, and they do absolutely wonderful work, and it's a wonderful place to check out. As an aside, you mentioned quite a few times about this being a New York City thing. I currently work with indigent individuals who have severe psychiatric disabilities, and one of the major public health issues facing New York City right now, a little bit worse last year, is the use of synthetic cannabinoids, very often leading to hospitalization. And what I'm finding with a lot of my population is there's a big problem where essentially they end up in the psychiatric emergency, and then they end up in inpatient, and it takes them a very, very, very long time to stabilize after major K2 experiences, partially because that setting and the individuals who work in that setting are totally unprepared to help people integrate these sorts of experiences. And I was wondering if you'd be interested in helping to bring that to some of the city and state hospitals to kind of that is a very big issue in New York City right now, and you guys have a wealth of knowledge that isn't really being tapped.
Well, maybe I could say a few words about that. I mean, I don't know. I think it probably varies from place to place, but I also have to say that I'm one of those people that works in those settings. So, and so I've seen variation in terms of the quality of the care. But I do think that, at least in the setting that I worked at, there actually is a lot of awareness of the fallout from synthetic cannabinoids, and also treating people with respect and understanding sort of the line between something that might be a psychotic disorder and something maybe like a spiritual emergency. I mean, it really depends on who you encounter, but there is, I think, a continuing emerging awareness of that. And in terms of one of the missions of our program really is, which I really want to do more and more of, is addressing exactly what you had mentioned, which is training mental health professionals to understand the motivations behind why some of their clients might be using psychedelics or MDMA, so that they're better equipped to respond in an appropriate way, whatever that may be. Yeah, it's a very important...
Yeah. I don't know. I guess the part of your question is kind of how can the trained professionals get more okay going into these wacky places with people? I mean, one way is for those trained professionals to do their own experiences, but that's probably not something that let's just put that one aside. So I was helping lead a sanctuary space at a festival out on the West Coast, and this woman came up to me and she said, well, I'm not interested in psychedelics and I don't do them and I'm not even curious, but should I still come to your workshop about holding psychedelic space? And I said, I think so. And she sat through the whole thing and she said, what you guys are describing and illustrating of how to be with people and how to hold space for people applies across the board to all these different environments. And so maybe some of the people you work with would love to come to one of our workshops, where some of what we're talking about is very specific to psychedelics, but a lot of it could be applied more broadly to really intense psychiatric situations, and how to do harm reduction and holding space and working with integration. So, but if you have ideas in particular of how we could help educate and create that connection, I mean, we'd be all for it.
Absolutely.
I was just wondering if you could speak a little bit to any sort of utilization of the creative process through some of your program. Did you guys hear me okay?
Utilization of a creative process?
Like the creative process, like an abstraction of some of the dialogue that you are talking about, visual language, anything like that, if that's kind of on the table at all.
Is that something you know about? Do you want to come do something like that in the space?
Yes, for sure. Yes.
This is exactly what I mean. I don't know anything that you're talking about, so we need people like you who know what you're talking about to come do it. That sounds awesome.
Okay, yeah. Well, I'll talk to you.
Okay.
Thank you.
Yeah, I was wondering if you can speak to, because I saw that the title was Integration from Individual to Community, and one of my own interests is how individual integration, such as integration of subpersonalities, might correlate with overall integration, community integration of multiple individuals, community level, national level, etc. And I'm just wondering if you have explored that at all, what some of those correlations might be.
I'm not quite sure if I understand the question. So,
It's kind of a scale-related question. So, is there, and if so, what is the correlation between the individual's integration, so kind of the dispersion of the individual to a sense of wholeness and oneness, and the integration of community to a sense of wholeness and oneness that is not assimilation, but a true integration. So there's a true working together, again, of either the subpersonalities or the individuals in a community.
Well, I don't know if I know how to answer that question, but I can sort of, I'll answer it in a way that I kind of hear it. And that's sort of the reflection of society in the people that we see. And I think that's very true for our groups, that in some ways we, I think, have like our finger on the pulse of at least what's happening in New York City. And New York City is a very unique environment, but in terms of the substances that people choose to use, and how they go about using them. So particularly I'm thinking about ayahuasca, or I'm thinking about microdosing, things that are sort of shifting. And you know, I guess our approach to that is, it depends, but I think it's really the group coming together to help each other. And sometimes they know more than about, they are better supports than we are for them as the leader.
Sure. I mean, something, I guess, maybe there's a kind of subtext to your question. I'm not sure I understand all parts of it, but there was a panel recently led by one of our advisory board members, Dimitri Mougianis, and about psychedelics and race. And we wanted to continue the conversation that he started with this question: why is the psychedelic community whiter than the Tea Party? And when all of these traditions come from people who most of them don't have white skin. And so where are those people? Where are the voices? Why are they not up in front of, big crowds? They're doing a lot of the actual healing ceremonial work with communities that we haven't really created those bridges with. And so we are continuing that conversation in the best way we can through one of our groups coming up in December. It's on psychedelics and social change. And we're actually asking, I think part of the question you're asking, which is, so if an individual becomes more whole and well and more integrated, so what? Does that actually impact anybody around them? Does it impact these systemic problems of violence and racism and sexism? Or does it just make a lot of really kind of now psychedelically infused egos more egotistical, so that they're just like feeling better in their little bubble? It's an open question for me. I don't know. I mean, I see lots of people benefiting from psychedelics, and I haven't, maybe it's not as obvious, but I haven't seen as much shift in the kind of these broader, more systemic problems. And Dimitri talks about a structural analysis that certain plant medicines with certain ceremonial rituals can actually take you out of your little individual kind of idea about what your mind and self is. So rather than just integrating your idea of what you are, you're kind of breaking open that idea and and sending those shoots and connections out into the world. But I don't have an answer, and I think we're trying to explore that. And If our program can be a part of extending things from the individual out into the community to actually affect change for people who have never heard about psychedelics and don't even care about them, I think that that would be a huge contribution.
Thank you. Thank you so much. Catherine MacLean.
Thank you, everyone.
Ingmar Gorman, thank you so much. Thank you both.